Hello and welcome to the program. I'm your host, Neal Howard. Thank you for joining us here today. Our guest is Dr. Jaime Ramos, a family practice specialist in Temple City, California. Also with him is Dr. Alan Nissenson, and Dr. Nissenson is an authority on kidney disease. They're both here to talk with us about chronic kidney disease. Welcome to the program, Dr. Nissenson and Dr. Ramos.
Thank you very much.
Thank you for joining us today. Thank you. Kidney disease awareness is coming up pretty fast, I do believe.
Yes, it is.
And Dr. Nissenson, could you explain to us exactly what is kidney disease?
Sure. As most people know, we have two kidneys, which is sort of the good news, because if one is injured, you have a spare that can really take over all the function. Okay. But unfortunately, medical diseases of the kidney tend to affect both kidneys equally. So if you have kidney disease, it generally means that the kidneys are unable to carry out the important functions of getting rid of toxins, fluid, and maintaining the normal chemical composition of the body.
So if this chemical composition isn't maintained and these things aren't eliminated or dealt with by the kidneys, what happens then?
Well, unfortunately, fluid accumulates in the body, but also a lot of toxic waste, and the chemistry disruption that occurs causes patients to have a variety of symptoms. They feel weak, nauseated, and eventually can't even function unless they get some outside support, either with a kidney transplant or by dialysis.
Are those the only two options for such a scenario?
Well, some patients choose just to use diet manipulation, which can control some of the symptoms for some time. But other than that, really dialysis or kidney transplant are the two options.
So what are the numbers? How many people are affected directly by kidney disease?
Well, it really is amazing. Kidney disease is one of the top 10 leading causes of death in the United States. And actually, about 1 in 10 adults over the age of 20 has kidney disease. So that's probably over 30 million people in this country.
30 million people. Now, you mentioned some age factors there. Dr. Ramos, who else is at risk for kidney disease? Somebody that maybe we don't realize is part of this huge number. Who else is at risk?
Certainly, patients who have underlying conditions that are diagnosed by their clinicians, those that have diabetes and hypertension, blood pressure, are at greatest risk for developing kidney disease. And the good news is that these conditions, if detected early and treated aggressively by their clinicians, they can help sort of slow down the progression of damage that can occur to their brain, their heart, their kidney, which is very important.
As I was talking with Dr. Nissenson, there are so many things that are affected when the kidneys lose their function. What are some of the first warning signs that you may be suffering from kidney disease or chronic kidney disease? Is it often misdiagnosed before it's properly diagnosed? Is that part of the problem?
Certainly, I think chronic kidney disease is one of those conditions where when it starts initially, you really don't have a lot of symptoms. So the best way to safeguard against like having a kidney issue is definitely have an assessment by your primary care clinician to do some basic testing, some basic blood work that you can do that helps sort of give you a general sense of what your kidney function is. Your clinicians can explain your results, but I think prevention by timely checkups is a way to sort of detect it early, because most patients in the early signs, even with hypertension, even with diabetes, don't have really full-blown symptoms. And I think when you take a thorough history, you'll be able to sort of, your clinicians can sort of piece together both on measurements on the exam and also with blood work, if you're at risk or if you're heading toward that potential challenge of these conditions. The good news also being that lifestyle choices and proper treatment can sort of reduce your risk to getting there. I'll let Dr. Nissenson discuss what happens if you're already there and how you can manage that condition.
Great. Now, Dr. Nissenson, in addition to that, could you explain what is the difference between kidney disease and chronic kidney disease? Or is there a difference?
Sure. Absolutely. So kidney disease is just a very general term that is applied to any medical condition that affects the kidneys, no matter how severe, chronic kidney disease really represents an advanced stage of kidney disease where patients have had an early problem, but it's advanced to the point where some intervention and treatment of some sort is needed. Right now, we know there are 5 stages of kidney disease, and generally, stage 1 is the earliest. When you get to about stage 3, we start using the term chronic kidney disease, meaning it's going to be around for a while.
Now, you mentioned some age factors early on in the interview. Do you ever find a chronic kidney disease situation in a younger person? Is that a rarity?
It's less common, but I wouldn't call it rare. The conditions that lead to chronic kidney disease are slightly different in young people. It's more likely to be caused by an inflammation of the kidneys or a congenital or hereditary problem, which is a little different than in older people, but it still does occur.
So how does one find out if they've got chronic kidney disease?
Well, I think as Dr. Ramos pointed out, symptoms sometimes can be very subtle, but diagnosis is really easy through a simple blood test or a simple urine test, which can be done by your primary care physician or any physician that you're seeing, and either one of those tests will diagnose chronic kidney disease if it's there.
Are you aware of any testing for home use? There are so many tests that are available now for different types of ailments and whatnot. Is there anything that a person who thinks they may have symptoms just simply try it at home before going to see their physician? Well,
really, the most important test, as Dr. Ramos pointed out, is a simple blood test, which you can't really do at home.
Okay.
There are dipsticks, little sticks you can buy at the drugstore to dip into your urine to look for things like sugar or protein. But in general, it's probably better to get an evaluation by a physician and get the blood test, which is much more specific.
So Dr. Ramos, what can we do to just prevent kidney disease altogether?
Well, once someone has a chronic kidney disease, it can be treated with medication and treatment, but oftentimes for those patients that already lapsed in that type of condition, there's no cure. One of the main strategies of treatment would be for prevention would be proper diet and medications for those who have underlying conditions like diabetes and hypertension and obesity. So the message I want to give to our listeners is that certainly you want to be really aggressive in finding out if you have these conditions, which your clinicians can easily tell you if you have diabetes through testing. If you're overweight, there's a lot of ways that your audience can, through online applications, to calculate your BMI, which is your body mass index. It's the basic measure looking at your height and weight to calculate where you're at. If you go to a store and buy a pair of pants and your waistline, if you're a male and your waistline is over 40 inches, you're at risk for your risk for obesity. These are basic things that patients can understand. The calculators are available on apps and on smartphones, also to give you a more sophisticated number calculation and can sort of tell you where you're at in the obesity range. But again, talk to your doctor and to help give you some guidance.
Now, Dr. Nissenson, I do understand that there's no cure, and we're talking about a lifetime of management. But say you're not, you don't have chronic kidney disease, and you're in the early stages of kidney disease. At that point, can things be reversed so that you don't suffer later down the line?
That is a really important point, and as Dr. Ramos pointed out earlier, much of kidney disease in adults is related to obesity, high blood pressure, and diabetes. And it's been found that in those patients, healthy lifestyles, so appropriate weight loss, really good control of blood pressure, and really good control of blood sugar in diabetics can not only arrest the progression of chronic kidney disease, but it can actually reverse it if these things are done early on in the course.
Even though there are so many people that suffer from this condition, Dr. Ramos, what makes it so difficult to diagnose?
I think partly like the other conditions we mentioned, both diabetes and hypertension in its early stages, there are not a lot of classic symptoms that people can relate to in its early stages. And oftentimes patients who don't receive adequate medical care, who wouldn't receive the initial blood testing for testing for other conditions, often present to our clinicians late. So when the disease is already advanced to a point where prevention is going to be very difficult, but not and difficult to manage. So I think the lack of clear-cut symptoms in the early stages, and also the level of health literacy can also affect people's ability to interface with their clinicians and try to engage their doctors about just prevention.
And where can our listeners go and get more information, Dr. Nissenson?
Well, we have what I think is a great program in honor of National Kidney Month. The organization that Dr. Ramos and I are affiliated with, DaVita, has a terrific website, davita.com/learnyourrisk, where people can go and get all kinds of information about chronic kidney disease, including going through a series of scenarios where they can determine their risk for kidney disease, look at diets, nutrition, and a number of very helpful tools that will assist them in understanding whether they have chronic kidney disease, and if they do, how to best cope with that. There are many other very good resources. Probably the best is through the National Kidney Foundation, which can also be accessed online.
Great. Well, it's certainly been a pleasure talking with both of you today. I thank you both for coming in.
Thank you very much. Appreciate it.
Thank you for having us.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been talking about chronic kidney disease and some tips to treat, manage, and possibly prevent the condition altogether. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, and you can listen in and download as SoundCloud.